Here at the American Academy of Dermatology in Washington, D.C., I spoke about some of the laser complications that we should be aware of. First of all, when we're using ablative lasers, we can see post-inflammatory erythema for a while. This can last sometimes several weeks, and there's really not a great way to treat this in terms of topical steroid doesn't always improve this. Some of the topical vasoconstrictor products don't necessarily improve this, but it is really important that patients embrace really diligent sun protection using a physical block sunscreen, either zinc or titanium, and really reapplying frequently every 90 to 120 minutes, because one of the other things we're concerned about is post-inflammatory hyperpigmentation, and that's something that we've certainly seen. The other things that we have to think about in terms of these patients is really understanding what symptoms they should be looking for in terms of some of the signs of healing. So sometimes people confuse some of the fibrin that we tend to see after full field ablative erbium resurfacing with infection. So simply because it's yellow, they might be concerned about infection. So I think it's helpful to show patients photos ahead of time, especially your own patient's photos, so that they can actually see the sequence of healing and really understand what to expect. And then there are circumstances where infections happen. We've certainly seen HSV happen, and in some cases those patients haven't taken their whole prophylactic prescription for antivirals, and in some cases they were on old-fashioned acyclovir, which doesn't have the bioavailability of valcyclovir, so they get a more effective serum level with valcyclovir. And then lastly, there are situations where there's some bacterial issues, and we really have to be attuned to that, looking for not just the yellow discoloration and some of the drainage that you would expect, but oftentimes little pustules that form. And I've seen from people who've used topical antibiotics for a long period of time after resurfacing instead of just a white petrolatum, I've actually even seen people who've developed a yeast process that has been KOH positive. So I think there's a lot of things to think about in terms of some of the things that we need to see patients back for when they have a concern about the appearance of the skin after resurfacing.